Today I'm going to talk about two case studies that come from the book. They come from a chapter in the book that's called Getting Started in Building a Strong Team. This chapter is really based on the premise that if a team is a sum of its parts, then building a strong team will take some work to put all the right parts into place. The chapter also addresses building from strengths as opposed to trying to make up weaknesses, which is a philosophy that I use in my work. I always try to build from our strengths as opposed to trying to make up for weaknesses. I'd like to share with you these two case studies. They're both related to one another. One is assessing your own strengths as part of a team and how you can articulate that so that you can articulate your value as part of a team. And the other is about assessing the team for strengths and skill gaps, and on planning as a leader and as team members how you can fill those gaps. So the first case study is about a Doctor of Nursing Practice program graduate who's applying for a position on an interprofessional team who is working to develop a statewide smoking cessation program for pregnant women. And this program is to be implemented in clinics and hospitals and private practices across the state during the prenatal period. An evidence-based protocol has been developed by the team, and the challenge of the team will be, there will be several challenges. One will be to coordinate the efforts across all of the multiple agencies that will be involved. Another will be to gain reimbursement for the intervention, so there will be some policy work that will need to be done. Another one will be to roll out the intervention in unique ways in all of these different sites that are different types of organizations. They serve different types of clients. They have different cultures, different populations. And then also to make that change stick so that the intervention continues long after this program and this team has been dissolved. And then finally to evaluate that intervention. So the team has obviously some challenges ahead. Clearly we know that Doctor of Nursing Practice graduates are prepared with the competencies that are related to evidence-based practice, for instance, leadership, change, health policy. All of those are part and parcel of the DNP role. But the challenge for this nurse is how does he or she articulate these skills to the team during the interview process? So in the book, I've provided a series of questions that you can use to think about when you're thinking about your own skills as part of a team. They're used for self-assessment, and they're questions like, how do I usually work when I work in a team? Do I prefer the big picture, or do I prefer to be a detail person in a team? Do I take a more active role? And when I do take an active role, what's happening to make me take an active role? These questions are all designed to help the team member understand their value as a part of the team and then to be able to articulate that to the actual team. So if you want to consider the difference then between a potential team member who says, in this case, I learned about change and leadership and health policy in my DNP program, or the one who has taken time to answer those questions for themselves, to do that self-assessment and reflection, and that team member says in an interview, my role in teams is typically as a strategizer. I'm usually a problem solver. I'm called upon to be a negotiator. I've been called upon by my teammates to think about multiple solutions to different problems that we face and to try and guide us toward consensus related to those problems. I usually serve as the spokesperson for groups. I'm able to articulate ideas clearly and to a variety of different audiences. I'm energetic when I present. But I'm not great at handling large data sets, so I prefer to have team members who are able to do data analysis and that they take the lead in this area. So this response by the DNP graduate really shows a great deal of insight. It shows that applicant for team membership has taken some time to think about what the challenges of the team will be, what the position will require, and how that member of the team can enhance the work of the team. So there's a lot of personal insight there, a lot of ideas about his or her own talents and strengths, and finally how they can also benefit that team. Sharing those insights with the team can help the team who is looking at who do they want to be a member of their team see how this person really will fit in, and what strengths they're going to bring to the team. It really shows the difference between someone being introspective about their role as a team member and one who hasn't taken the time to evaluate their own strengths as it relates to a team. And I really do believe that if we're intentional about identifying our strengths and articulating our strengths as a team member, that it only leads to the team's success. So that's one of the case studies that's found in the book and is hopefully helpful to you as you think about yourself as a member of the team.